high yield points of endocrine system. Every year, 2 to 3 MCQs comes from this portion. So it's very important for exam point of view. The one first one is the most common functioning pituitary adenoma is prolactinoma. Amenorrhea, galactorrhea, loss of libido, and erectile dysfunction is the clinical feature of prolactinoma. Growth hormone adenoma is the second most common functioning pituitary adenomas, macroadenomas in 75% of cases. The first sign are symptoms of hypopituitarism. Secondary to pituitary tumor is hypogonadism because the hormone which lasts first is growth hormone TSH, and last one is ACTH. Craniopharyngioma is the most common cause of hypopituitarism in children. The most common cause of death in acromegaly is heart failure from cardiomyopathy. Acromegaly occurs due to increase in growth hormone level after closure of epiphysis. Gigantism occurs due to increase in growth hormone before closure of epiphysis. Layer of layer of adrenal cortex, remember by mnemonic GFR: zona glomerulosa, zona fasciculata, and zona reticularis. The most common cause of Cushing syndrome is corticosteroid therapy. Iatrogenic. Exogenous cause the most common pathologic cause is pituitary Cushing syndrome. Cushing syndrome secondary to pituitary tumor is called Cushing disease, and the most common cause is endogenous. The most common enzymatic defect in congenital adrenal hyperplasia is 21 hydroxylase enzyme deficiency, which is required for cortisol biosynthesis and accounts for more than 90% of the cases. Congenital adrenal hyperplasia patients have ambiguous genitalia. Aldosterone secreting adenoma is also called Cohen syndrome. Miliary tuberculosis is the most common cause of Addison disease in developing country, and autoimmune adrenalitis is the most common cause developing in developed countries. Moon phase, hypertension, hirsutism, central obesity, and stria is the most common clinical presentation of Cushing syndrome. Renal failure is by far the most common cause of secondary hyperparathyroidism. The most common cause of severe hypercalcemia is malignancy. Level of cholesterol is elevated in hypothyroidism. Subacute lymphocytic thyroiditis is also known as silent or painless thyroiditis. The most common intracellular tumor are pituitary macroadenoma. The most common supracellular tumor are craniopharyngioma. The most common paracellular tumor are meningioma. Hashimoto thyroiditis are also known as chronic lymphocytic thyroiditis. Silent thyroiditis is also known as subacute lymphocytic thyroiditis. Recurrent thyroiditis is also known as subacute granulomatous thyroiditis. Painful thyroiditis unique feature. It's painful. Diabetes mellitus. Type 1 diabetes, diabetic ketoacidosis, which is characterized by hyperglycemia, hyperketonemia, and increase in anion gap metabolic acidosis. Type 2 diabetes mellitus, hyperosmolar non-ketotic coma, which is characterized by severe dehydration resulting from sustained osmotic diuresis, and urinary blood loss due to chronic hyperglycemia. The inheritance in type 1 diabetes mellitus is polygenic. Obesity is the major cause of increased insulin resistance in type 2 diabetes mellitus. Type 2 diabetes have greater than 90% concordance rate in identical twin.